Mabuhay and welcome to Basics 101. Today we are going to talk about what is a dislocated shoulder and the steps on how to apply first aid to a dislocated shoulder.
Let us first define what is a dislocation. A dislocation is an injury in which the ends of your bones are forced from their normal position. Dislocation happens when a strong force pulls or tugs the bones. Normally, dislocations are a result of a fall, an auto accident, or a collision. What are the signs and symptoms of a dislocation? 1. Pain at or near the site of the injury. 2. Difficulty or impossible to move the joint. 3. Loss of power. 4. Swelling. And lastly, discoloration and bruising.
Hello everyone, let's talk about joint dislocations, specifically posterior, anterior, and inferior dislocations. Imagine your shoulder joint. If the arm bone is forced backward out of its socket, we call it a posterior dislocation. It's like the bone is moving towards the back, disrupting the normal position of the joint. Now think about the opposite. If the arm bone is pushed forward out of the socket, it's known as anterior dislocation. This happens when the bone moves toward the front, causing a misalignment in the joint. And then there's the less common one. If the bone is forced downward at a joint, we call it a inferior dislocation. It's when the bone moves toward or downward direction, deviating from its usual point. So, to sum it up, posterior is backward, anterior is forward, and inferior is downward. Understanding these terms help us describe different types of joint dislocations. I hope this helps. Proper bandaging of dislocated shoulder. Materials needed: triangular bandage and safety pins. First step, prepare the patient. Have the person sit or lie down comfortably. Provide support to the arm to minimize the movement. Second step, apply a sling. If available, a triangular bandage can be used to create a sling. Place the point of the triangular bandage under the elbow of the injured arm, and bring the ends around the neck, tying them securely. Third step, secure the bandage. Once you reach the end of the bandage of the wrist, secure it with the clips or tape. Avoid placing the clips directly on the skin to prevent irritation. Last step, seek professional medication. Even with proper bandaging, it is crucial to seek professional medical attention promptly. Remember that bandaging is a temporary measure to provide support until professional medical care can be obtained. A healthcare professional will assess the injury and may recommend further treatment, such as physical therapy or surgery, depending on the severity of the dislocation.
A dislocation is an injury in which the ends of your bones are forced from their normal positions. The cause is usually trauma resulting from a fall, an auto accident, or a collision during contact or high-speed sports. Dislocation usually involves the body's larger joints.
For the additional information about treatment, shoulders are the most commonly dislocated joint. Treatment of a dislocated shoulder will depend on the patient's symptoms, age, and general health. Treatments may include moving the head of your upper arm bone back into your shoulder joint or reduction, often with an anesthetic. Limiting shoulder movement immobilization with a sling after reduction. Rehab or rehabilitation. Surgery if non-surgical method don't restore stability. And for the prevention, Complications of a dislocated shoulder might include tearing of the muscles, ligaments, and tendons that reinforce the shoulder joint, nerve or blood vessel damage in or around the shoulder joint, becoming more prone to repeat dislocations, especially if the injury is severe.